You've noticed something unusual down below, and you're not sure if you have genital warts or herpes. Well, in this video, I'm going to go through the exact differences so you can easily spot what's going on down below. Let's start with a quick bit of science to understand what genital warts and herpes are. Genital warts are caused by the HPV virus, the human papilloma virus. This is one of the most commonly sexually transmitted infections in the world. It also is linked with cervical cancer depending on the strain of HPV you have. HPV strains number 2 and number 4 are most commonly associated with genital warts. There are, however, other strains associated with cervical cancer and other health conditions. Genital warts appear as small flesh-coloured lumps or possible cauliflower-like lesions in your genital area. Whilst genital warts are generally painless, you might find them quite uncomfortable, or you might be a bit self-conscious when you notice a lump down below. Often I notice with my patients, they're incredibly worried about how it's going to impact their life. I recently had a 25-year-old patient who came to see me because she noticed a lump down below. After examining her, I thought she may have a genital wart, and therefore I referred her onwards to a sexual health clinic. At the time she saw me, she said she was really worried about the impact on her life. She said she was dating and she was worried this was going to make her very self-conscious and unable to date. After attending the sexual health clinic, she was able to get treatment for her genital warts along with counselling to help her manage her psychological stress from the warts. They also taught her more about the HPV virus because knowledge is power, and this way when she decides to open up the conversation about genital warts, it gives her more confidence on what she needs to share. Understanding herpes. The herpes simplex virus is generally divided into 2 types, HSV1 and HSV2. HSV2 is generally associated with genital herpes. This causes painful sores in your genital area. HSV1, on the other hand, is often linked to cold sores or oral herpes. However, HSV1 can spread to the genital area if you engage in sexual activity when you have active lesions. I recently had a 30-year-old male who came to me with what looked like genital herpes down below. He was finding the burning and the stinging down below when he had the blisters really painful. I was able to give him advice on how to manage his symptoms, which I'll go through in the video, along with steps he needs to take in case he has another outbreak. Once you have the herpes simplex virus, you may go on to develop regular outbreaks. I was able to give him treatment on how to manage his current infection, as well as advice on what to do if it comes back. Once you have the herpes simplex virus, there is no cure for this, and therefore you may go on to develop more outbreaks in the future. How do they spread? They both generally spread from sexual activity. With genital warts, you may have the virus for months or years before you have symptoms. Whereas with herpes, the incubation period, or the time between getting the virus and symptoms, is a little bit different. With HSV2, which is generally linked to genital herpes, the time between getting the virus and having an outbreak is generally thought to be around 2 to 12 days, but this can vary from person to person. It's often affected by how healthy you are and what your immune system is like. Diagnosis and treatment. If you notice you've got lesions down below, it's generally best to see a doctor so we can tell you exactly what's going on. But warts and herpes look quite different, so I'm going to show you some photos now. As you can see here, genital warts is generally small, fleshy coloured bumps. And as you can see here, genital herpes are generally blisters and sores down below. In order to diagnose patients, if you have a herpes outbreak and you have active lesions, a doctor may take a swab and send it to the lab so we can test for the HSV virus. Just to be clear, we need to take a swab with the active infection, so when you have herpes and you have fluid, we can send a sample of that fluid onwards to the lab. Treatment. As I've explained earlier, genital warts and genital herpes are caused by different viruses and therefore they're treated differently. With genital warts, we often use topical treatments, which is creams we apply onto the skin where you have the active wart. Common prescription-only medications you might see are surgical removal. Sometimes when you have warts, we may consider surgical removal or cryotherapy freezing treatments. Remember, these methods are to be done by a doctor so we can prevent you developing any complications. With genital herpes, this is treated differently to genital warts, and we may use antiviral medications. Commonly used names are here. These drugs aim to reduce the severity of your outbreaks. they also aim to shorten the duration of symptoms, so therefore reduce the amount of time that you have the blisters. For people who are getting recurrent outbreaks, we may consider regular antiviral medication. This will depend on how frequently you're having the outbreaks. As I mentioned earlier, I did have a patient who had very severe pain when he had his recent herpes outbreak. Home care tips I gave him were to keep the area nice and clean, using plain water to wash the area and avoiding any soaps or irritants, applying cold compresses to help ease his burning symptoms, so to put some ice in a cloth and then put it on the area, but avoid this if it causes too much discomfort. As he had severe burning symptoms, I told him to put some ice in a cloth and put it near the area, therefore to help with some of the burning symptoms he was having. Over-the-counter pain relief, so I told him to try paracetamol or ibuprofen because it was safe for him to use these and they can generally help alleviate some of the discomfort he was having. Keeping well hydrated, because he was having some fevers and feeling quite hot and sweaty, I advised him to make sure he was drinking enough fluids. Avoiding tight clothing, because he was having a lot of stinging down below, I advised him to wear loose-fitting clothes so we can avoid any extra irritation or rubbing from the clothes. I also prescribed him some antiviral medication. The important thing to note with antiviral medication is we generally aim to start it as quickly as possible when you have an outbreak. This is generally within the first 2 or 3 days, but could be given up to 5 days since onset. If you, however, have severe symptoms, your doctor may still give you the medication, so it's worth chatting with them. Another tip I gave him is because he was having so much burning when he was peeing, I advised him to run a bath or try to pee in the shower to help with some of his burning symptoms. When I followed him up a few days later, because he started the medication and was practicing his self-care, he found that he was feeling much better with his symptoms and he found he was having a lot less pain. Summary table. As you can see here on this table, these are the main differences between genital warts and herpes. Thank you for watching this video today, and I hope you're a lot clearer on the differences. If I can ask for a favor, if you click the word subscribe, it really helps my channel to keep growing. And if you have any questions, feel free to write them down below or share your experiences.